gentlemen, please welcome Professor Dr. Alia Al Ghwiri to give a keynote speech on effect of transcranial direct current stimulation on sleep in athletes.
Good morning, everybody. Thank you so much. I would like to thank Rifa University for their invitation and generosity, especially Dr. Shakil Al-Rahman and the organizing committee. Thank you so much. So I will talk to you today about sleep. I hope that you slept well yesterday, first of all. The outlines of my speech, I will talk about what is the characteristics of sleep, also what's the importance of sleep so that you sleep well and try to do your best to sleep. What are the consequences of poor quality of sleep, especially in athletes and sports? And what is the role of you, especially physical therapists, in the management of sleep disorders? So I will start also with this verse from Quran. بسم الله الرحمن الرحيم. الله يتوفى الأنفس حين موتها والتي لم تمت في منامها فيمسك التي قضى عليها الموت ويرسل الأخرى إلى أجل مسمى إن في ذلك لآيات لقوم يتفكرون. So we really need to think about sleep that was mentioned in Quran. And here, of course, as a neurological physical therapist, I go back to the brain. And the brain actually exists in three primary states. It's either awake, or sleep in the rapid eye movement, or sleep without rapid eye movement. So it's very important to know all of these three states of the brain. And when we talk about sleep, actually, it has four characteristics. Usually, there is a reduced motor skills or activities, decreased responses to stimulation, and here we're talking about visual and auditory stimulations, stereotypical postures, and this is your role as physical therapist also to help in these postures, and relatively easy reversibility. What are the roles of sleep? It's very important. The functions of sleep are very important for healthy individuals. As humans, actually, we spend approximately 1/3 of our lives in sleeping. So make sure that you sleep well in the third of your life. Also, it's very important for energy renewal. It is good for waste removal out of your brain. Also, it's very important for damage repair. So if you have any injury, even musculoskeletal injury, you need to sleep well in order to get better. Also, it's important for information organization. So for students, since our audience are mainly students, to organize all of these information that you gain from the university, you need to sleep well. Also, learning consolidation. So just before the exam, you need to sleep very well, because all of these learning and memory will be consolidated in your brain so that you can answer your exams. At the level of the brain, actually, sleep is very important for cognitive functions, and at the level of the body, it's very important for appearance, for immunity function, and for metabolic functions. So let's go directly to athletes, okay? Just to get into this topic. So when we talk about sleep in athletes, actually, it was found that sleep disturbances are more common in athletes than other healthy individuals. So the prevalence is between 50 and 78% among elite athletes. So here we're talking about, the elite athletes, and it is more prevalent compared with non-athletic population. And what are the disturbances of sleep that they suffer from? They usually suffer from shorter sleep duration, which is like about 6 hours, longer sleep latency, they need more time to fall into sleep, and lower sleep efficiency, what we call lower quality of sleep. And here, what are the negative effects or impact actually of sleep in everybody, and especially in athletes, that they have? The consequences is impaired brain function that could affect their judgment and decision making. And in athletes and in sports, it's very important to have good judgment, right? Because you need to take a decision with sometimes milliseconds, right? So it's very important to be able to take these decisions in the right way. Also, it's important that if the bad effect of poor quality of sleep is to increase the pro-inflammatory cytokines. And you know that athletes all the time have some injuries, so this will increase the inflammation. Also, poor quality of sleep may impair their immunity system and immunity functions. Also, it impedes muscle recovery and repair from any damage. So again, even musculoskeletal is very important. Okay, thank you. It might also lead to autonomic nervous system imbalance. And finally, it alters pain perception. So they might, if they don't sleep well, they will feel pain more. So it's very important to understand the effect of poor quality of sleep. And here, I'm sure that you will ask yourself, why are athletes are more susceptible or to sleep disorders? Or why quality of sleep is poorer in athletes more than the non-athletic population? And there are many reasons, and they usually categorize them into two categories: sports reasons or factors and non-sports factors. And this is actually usually related to training schedules, to jet lag because they travel a lot, to smartphones and the screens that we use all the time, and the stress and anxiety that they feel and they face actually. So other factors are related to sports, such as high training loads, unfamiliar sleeping environment that they travel to all the time, early morning trainings, long haul travel, and night competitions. The non-sport factors are related to individual chromatics, sometimes social demands, and even habits may be considered. So what's your role? It's very important here to know what are the roles of physical therapists in sleep disorders in athletes. Well, first of all, you need to assess the sleep all the time with any individual, not only in sports or athletes. So always ask your patient when they come to the physical therapy session, did they sleep well last night? Okay? If they didn't sleep well, they will not be cooperative with you. They will have many problems, okay? Also, you need to refer. Sometimes you cannot deal with these sleep disorders until you refer them to the physician who is responsible. Okay, sorry. So you need to refer them to the physician to treat them or to give them some medications. Okay, it's not synchronized. Sorry about that. Also, you need to provide some management, and we will talk about. Yes, this is it. Thank you. So you need to provide them with a sleep hygiene, and we will talk about it. Positioning during sleep is very important, and it's your role to educate them about the best positions that they can use. Also, the exercise program, because there are many research articles now that say that exercising in the morning or during the day will help them sleep well during the night. So it is physical therapy. Also address any bed mobility issues. So there are many general questions that you can ask your patient about sleep, but also you can use standardized assessment such as the Pittsburgh Sleep Quality Index, the Epworth Sleepiness Scale, and Insomnia Severity Scale. All of these actually questions that you can ask are included into these questionnaires that you can hand out to your patient in the waiting room, for example, to fill out, or you can ask them directly, okay? Also, there are some objective assessments. So polysomnography, or what is called the sleep lab, is the gold standard for any sleep disorders. So if you find that you cannot detect the sleep disorders in your patient, refer him or her to the physician, and they will ask them to go for sleep lab or polysomnography to understand what's specifically the sleep disorders that they have. What about measuring actual sleep? Also, what's our role? We can give them some diaries to write down when they go to sleep, how long does it take from them to stay in bed before they fall asleep, and so on. And now we have the actigraphy, or the watches that monitor us and monitor our sleep, which is really helpful. So this is also another option that monitors the sleep time and the sleep efficiency. Actually, they are activity monitors, but they also assess sleep. So let's go to the management of sleep disorders and talk about sleep hygiene. Thank you. So actually, sleep hygiene is a set of instructions to modify behaviors and sometimes the environment of your sleep area in order to promote your sleep. So there are set of things that you can tell your patient or even write them in your language on a sheet of paper and give it to your patient in order to modify their environment, their sleep schedule in order to improve their sleep. And this is used for mild sleep disorders or, you know, the minimal problems. Also, you can use, didn't work. Yeah, it didn't work. Thank you. Okay. What about positioning of sleep? Also, there is an evidence that suggests that acute and chronic exercise has moderate. I'm sorry. No. It's not working. I'm sorry. So regarding positioning, also as physical therapists, we can ask our patients if they have any painful position, for example, during sleeping, and modify it for them. So they can use pillows, they can use any assistive devices to help them sleep well. Regarding, okay. The third management that you can use also for sleep disorders is exercising, okay? And again, there is a plenty of articles that reported that exercising during the day will improve their sleep at night. And now I will talk to you briefly about a study that I'm still conducting, actually. Sorry about that. Okay. So actually this study was published last year. It's about the effect of transcranial direct current stimulation on sleep disorders in athletes. This was a protocol that we published. The ongoing clinical trial is still, you know, ongoing until the end of this year. So what is transcranial direct current stimulation? Actually, there is a growing evidence that using this electrical stimulation to the brain would help sleep disorders, okay? In general and specifically in athletes. So what we found actually that there is only one study with a low sample size that worked on athletes, and they were actually children, so below 18 years old. So we thought that there is a gap in the literature of using this TDCS with a higher sample size and adults above 18 years old. So that's why we, okay. So the study parameters that we used, actually, we included or recruited elite athletes. They were selected based on the eligibility criteria and randomly allocated into interventional group or control group. The interventional group was the TDCS, using the transcranial direct current stimulation. Each participant received a 20-minute session of bilateral anodal TDCS with an intensity of 1.5 milliampere in a density in density 3 times a week for 2 weeks. So they received 6 sessions, actually. The TDCS current was delivered only for 30 seconds in the control group, just, you know, to feel this stimulation, because it's a sham therapy. This is the outcomes sets actually subjective and objective sleep parameters, and they are so this is the inclusion-exclusion criteria, and these are the measures. So we use the objective actigraph watches for them 1 week before the clinical trial and 1 week after the end of the clinical trial. We also used insomnia severity scale, Epworth sleepiness scale, Pittsburgh sleep quality index, and since sleep actually affects psychological aspect, we also assess depression, anxiety, and the stress scale. Also, the quality of life SF12. This is the diagram this is the way that you use the software actually on the computer. As you can see, I hope it works. Okay, well, as you can see, we used the 2 points here in the prefrontal lobe, okay, to stimulate the brain. So 2 only, as you can see here also. Okay, so this is the diagram here. What we did actually that we screened patients. So regarding the athletes, we didn't include any athlete. We included only the athletes who suffer from poor quality of sleep based on Pittsburgh Sleep Quality Index. So whoever had Pittsburgh Sleep Quality Index of more than 5, we included them. So there was a screening test to include them based on Pittsburgh Sleep Equality Index, okay? So we included only athletes who suffer from poor quality of sleep. Here's the preliminary results. Actually, we included until now only 18 elite athletes have been recruited. 12 of them were in the interventional group and 6 in the control group. The age was 21. The males, females, actually they were equal, so 50% males and 50% females. The years of sport practice, actually the mean years was 6 years. And the type of sports that we included are individual sports, boxing, judo, and karate. So what we found actually until now between and within group differences, that there was no significant differences at baseline, which is good, between the control and the interventional group. But until now, there is no significant differences between them, even after treatment and at follow-up, because the sample size is still low. However, activity level actually in the interventional group was better than the control group after treatment using actigraphy monitors. So it's not the sleep indices that got better, the activity level got better, which means that maybe their sleep got a little bit better and encouraged them to do more activity during the day. We don't know, we're still exploring. Also, no significant differences within the control group after treatment or follow-up. So until now, within group, there was no significant differences. But within group differences in the treatment, as you can see, all sleep actually parameters. So Pittsburgh Sleep Equality Index, for example. So as you can see here, for example, Pittsburgh Sleep Equality Index was 5 at baseline, and it became 3. And lower is better. So they are improving, but until now, we're not getting the significance here. Okay? So for example, the ISI also, it was around 15, and now it's 11. So all the parameters, the sleep parameters, and other actually health parameters are improving, but not to a significant level. So we will see if there's a clinical difference instead of significant difference. But we are still recruiting, so we will see. So in conclusion, we can now confirm that athletes have a high incidence of sleep disorders, and there is a high impact of poor quality of sleep on athletes' physical and cognitive skills. Therefore, it is important to explore effective interventions of sleep disorders in this population. And in our study right now, actually, we think that using the TDCS will be really promising. At the end of my presentation, I would like to invite all of you to the World Physiotherapy Congress that will be held in Tokyo, Japan, after 2 years in 2025. Actually, this is an international conference that you can publicize your research there. You can actually also get the knowledge from other research studies that are held all over the world, and you can also connect and network with physical therapists all around the world. So please, from now, try to apply for the abstracts when the abstract is open and attend the conference. Thank you, and sleep well.